A new mental health care initiative was launched this year. The Regional Infant Mental Health Community of Practice is made up of providers from Winona, Wabasha, Fillmore, Houston, and Goodhue counties. The providers include those who serve children and/or their families from prenatal through age 5. Dr. Judy Woods is a clinical psychologist with Hiawatha Valley Mental Health Center, one of the member providers. Dr. Woods said infant mental health care is new to our area, but has been a part of infant health care in other parts of the country for over 20 years.
When we say infant mental health in general, it means kids from birth to 5 or to age 5. But definitely goes down very young. I've seen children myself in my office as young as 5 or 6 weeks old, all the way up. And so when children are very young like that, a lot of times people will ask, well, what are they seeing you for? That's very young. How would you even know something is wrong? And a lot of times those kids have had some risk factors that have happened to them during the pregnancy, or maybe had a traumatic birth, or something like that would have happened, or maybe there was some exposure to some substances or alcohol or something like that during the pregnancy, or a child protection concern. And what we look at for mental health for kids so young is really we look at the things that they should be doing. So we look at their sleeping patterns, their eating patterns, their ability to calm themselves down, their ability to tolerate emotions, their ability to create relationships, to learn, to explore, the tasks that you would expect kids of those ages to be doing. Infant mental health sort of comes into play when a problem comes up with one of those things. Certainly kids experience a lot of things in our world today, and it could be related to a problem has come up, and maybe it's related to a change in the family, or a change in daycare, or something different that has happened in their environment that they might be responding. The thing that we say when we're working with young kids is that it's about everything. Everything that sort of is coming into play for the kids becomes something that could either be a protective factor that helps them, bounce back and heal and do better, or something that causes them more difficulty.
According to Dr. Woods, another thing that can have an impact on a child's mental well-being is their parents' mental health.
When parents have experienced trauma themselves, in the form of maybe some sort of abuse in their own history, maybe a major car accident, could be a medical trauma, could be really all sorts of things that impacts how both the adult and the child enter the relationships with one another. And sometimes those patterns just don't mesh very well together, and so that's where we'll work in therapy on sort of healing those relationships on both sides. Because when we work with young kids, it's really important to work with the child and the parent together.
So why put such an emphasis on the mental health of the young? Dr. Woods said over time, a minor mental health issue for a child can grow into something more serious as they get older. By getting the child treatment earlier, children can be quickly put on the right course and prevent more serious mental health and social issues in the future.
That's one of the biggest pushes for infant mental health and early childhood mental health is, if the concern or the problem has been happening for a couple of months, the intervention to correct it is often much shorter and much more effective when they're younger. The longer it's been happening, the longer it's had, the longer it's sort of been repeated and reinforced, the more difficult it is to treat. When we're treating kids young, we can help them get back to their normal developmental path and be ready to enter kindergarten, be ready to learn, be able to create relationships with teachers and friends, and be able to use school that way. If we wait and leave it untreated, that's where we see kids getting older and having to have more special education services, having to have more interactions with the legal system, having to have more, just some of those negative things that are things that we don't want to see our kids have to go through.
Through a grant from the Greater Winona Area United Way, an early childhood Hope Line will be implemented. The line is for parents to call if they have questions about behavioral, developmental, social, or emotional issues their child might be having.